Till now we completed general introduction part of protozoology, then we completed Trypanosoma imensi and Trypanosoma theileri. Now in this video we will discuss the African animal Trypanosomosis, and the first species is Trypanosoma brucei. Host for this Trypanosoma brucei is horse, donkey, ox, sheep and other wild animals. And the location for this Trypanosoma brucei is blood, and the vector is Tsetse fly, that is Glossina. The vector for Trypanosoma imensi and Trypanosoma theileri is tabanid fly, and this Trypanosoma brucei is transmitted by cyclical transmission, and the development occur in the anterior station of the fly, that is salivarian trypanosoma, and the disease they cause is called as Nagana disease, and the meaning of Nagana is to be in low or depressed state. And morphology of these Trypanosoma brucei is they range around 12 to 35 micrometer. They are highly polymorphic. Kinetoplast is subterminal and posterior end is pointed. Undulating membrane is well developed. Large rapid movements are seen in confined area. Distribution is in mainly in African country. When it comes to life cycle, the development occur in midgut and salivary gland of the test fly for 2 to 3 weeks. Pathogenesis include biting a fly on the host, lead to formation of raised cutaneous inflammatory swelling in the skin. They are called as chancre. Afterward, trypanosomes are found in the intracellular tissue fluid, such as fluid of body cavity and plasma. In initial replication of trypanosomes is at the site of inoculation of the skin, and at the site of inoculation in the skin, this causes a swelling and sore chancre. Trypanosomes then spread to the lymph node and blood and continue to replicate. Thus, there is a persistent infection that results in continuing the cycle of trypanosomes replication, antibody production, immune complex development, and changing of the surface coat glycoproteins. Immunological lesions are significant in trypanosomosis, and it has been suggested that many of the lesions, anemia and glomerulonephritis in this disease, may be the result of the deposition of immune complex that interfere with or prevent the normal organ functions. And the most significant and complicating factor in the pathogenesis of trypanosomosis is the profound immune suppression that occur following the infection by these parasites. This marked immune suppression lowers the host resistance to other infection and thus results in secondary disease. In case of horse, this is the most severe disease which lasts for 2 to 4 weeks. In chronic form, it may run for several months. Clinical signs such as in acute case, hyperthermia, intermittent fever, rapid emaciation, ocular and nasal discharge, and icterus condition, and subacute edema in lower part of the thorax and abdomen can also be noticed. In chronic case, locomotor ataxia and general paralysis may develop. When it comes to the postmortem findings, there is anemia, emaciation, enlargement of lymph nodes, and splenomegaly. And in case of cattle, trypanosomes localize extravascularly and produce an inflammatory reaction of the skin wherever the fly will bite on the skin, leading to the chancre and subcutaneous tissue, heart, CNS, and eye. Inflammatory reactions are seen on the skin, subcut, heart, and CNS and eye. And in case of sheep, there is extensive localization of trypanosomes occur in the extravascular fluids, resulting in the mononuclear inflammatory reactions in heart, skeletal muscle, brain, eye, testis, and generalized lymphoid hyperplasia. And in case of dog and cat, fever, emaciation, and edema of eyelid and thorax. When it comes to the diagnosis of the um, Trypanosoma brucei, peripheral blood smear in acute infection is collected, and in chronic infection, organism may be detected in lymph node, bone marrow, and other organ smears. And sometimes inoculation of the suspected blood in the mice can also be carried out. And treatment aspect is similar to the Trypanosoma evensi. And to control the disease, control of Tsetse fly, And prophylactic treatment of animals with isometamedium at 1 to 2 mg per kg IM intramuscular, and proper nutrition should be provided in the propagation of indigenous breeds. This is about Trypanosoma brucei. This is an African Trypanosoma. Host range is horse, donkey, ox, sheep, and Vectaris testafly, glossina fly. And this is generally called as Nagana. Try to remember these points. In next video, we will discuss on another African Trypanosoma, that is Trypanosoma congolens. Thank you.